welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Dr. Priyanka Ahuja, and today I will be discussing a very interesting study about whether increased fetal movements during pregnancy can be a predictor of neonatal adverse outcomes. Reduced fetal movements are associated with several adverse neonatal outcomes, including stillbirth, fetal growth restriction, fetal distress, and preterm birth. Little is known about maternal perceptions of increased fetal movement. Several reports have suggested a single episode of increased fetal movements is a sign of an upcoming stillbirth. However, the data regarding an association between increased fetal movement and neonatal outcomes is sparse. Study in American Journal of Obstetrics and Gynecology aimed to evaluate characteristics and neonatal outcomes of pregnancies with perceived increased fetal movements, assuming it is a poor predictor of adverse neonatal outcomes. The retrospective cohort study included singleton pregnancies delivered in a tertiary referral hospital from 2014 to 2020. Patients presenting to the obstetric triage with a single isolated complaint of increased fetal movements at more than equal to 24 weeks gestational age were compared to a control group of patients presenting for routine fetal assessment during pregnancy or labor reporting regular fetal movements. Patients presenting with reduced fetal movements during their pregnancies were excluded. The primary outcome was the severe composite adverse neonatal outcomes of sepsis, respiratory distress, mechanical ventilation, cerebral injury, anemia, blood transfusions, or intrapartum death. The secondary outcomes was the mild composite adverse outcome including hypoglycemia, need for phototherapy, hypothermia, meconium aspiration syndrome, need for non-invasive ventilation, or umbilical cord pH of less than 7.1. A total of 43,714 women were in the study cohort. Induction of labor was more in the increased fetal movement group, 30.5% versus 21.7%. As well as vacuum-assisted delivery, 13.1% versus 8%. No differences were found between groups in terms of the severe and mild composite adverse neonatal outcomes, as well as other neonatal complications, including umbilical cord complications. No cases of stillbirth or intrapartum death were found in the increased fetal movement group. Multivariable logistic regression found that increased fetal movement was a non-significant risk factor for composite adverse neonatal outcomes, labor induction, and vacuum-assisted deliveries. Researchers concluded that maternal perception of increased fetal movement does not seem to be associated with adverse neonatal outcomes or umbilical cord complications. The perception of increased fetal movement is more common among nulliparous women. It might also be associated with greater awareness of fetal movements after sustaining abdominal trauma during the pregnancy. Placental location was not linked to increased fetal movement. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.